Have you ever eaten to the point of discomfort? Maybe you found yourself unable to stop, even when you knew you were full. Do you sometimes feel out of control around food? Like no matter how hard you try, you just can't resist the urge to eat? If so, you might be struggling with binge eating disorder or BED. This condition affects millions of people worldwide, often in silence. BED is a common eating disorder characterized by recurrent episodes of binge eating. These episodes are not just occasional overindulgence, but a persistent pattern. This means eating large amounts of food in a short period, often secretly and with feelings of shame and guilt. The secrecy can make it even harder to seek help. Binge eating disorder can have a significant impact on both physical and mental health. Physically, it can lead to weight gain, diabetes, and heart disease. Mentally, it can cause severe emotional distress, anxiety, and depression. It's important to understand that binge eating disorder is not about a lack of willpower. It's not something you can just snap out of. It's a complex condition with biological, psychological, and social contributing factors. Genetics, brain chemistry, and emotional health all play a role. This essay will delve into the intricacies of binge eating disorder, shedding light on its symptoms, causes, and effective treatment approaches. Understanding BED is the first step towards managing it effectively and seeking the help you need. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5-TR, outlines specific criteria for diagnosing binge eating disorder, commonly referred to as BED. These criteria are essential as they help mental health professionals make accurate diagnoses and provide appropriate treatment plans tailored to the individual's needs. To be diagnosed with BED, an individual must experience recurrent episodes of binge eating, which are more than just occasional overeating. A binge eating episode is characterized by eating in a discrete period of time, for example, within any 2-hour period. An amount of food that is definitely larger than what most people would eat in a similar period under similar circumstances. This is not just about eating a lot, it's about eating an unusually large amount of food in a short time frame. During these episodes, the individual also feels a sense of lack of control over eating. This means they feel unable to stop eating or control what or how much they are eating. Additionally, these episodes are often accompanied by feelings of distress, guilt, or embarrassment about how much one is eating. This emotional turmoil is a key component of the disorder. People with BED may also eat alone because they are embarrassed by how much they are eating. They might hide food or eat in secret to avoid judgment from others. Recognizing these symptoms is crucial for seeking help. Mental health professionals can offer support and treatment options, including therapy and sometimes medication, to help manage and overcome binge eating disorder. The causes of binge eating disorder are complex and multifaceted. They can vary from person to person, but often involve a combination of genetic predisposition, biological factors, psychological factors, and environmental influences. Genetic studies suggest that individuals with a family history of eating disorders may be more susceptible to developing BED. Furthermore, imbalances in certain brain chemicals, such as serotonin and dopamine, which regulate mood and appetite, may play a role in the development of BED. Psychological factors such as low self-esteem, body dissatisfaction, and difficulty coping with negative emotions can also contribute to binge eating. Recognizing the signs of binge eating disorder is crucial for early intervention and treatment. Early recognition can significantly improve the chances of successful management and recovery. In addition to recurrent binge eating episodes, individuals with BED may exhibit a range of behavioral, emotional, and physical symptoms. These symptoms can often be overlooked or mistaken for other issues, making awareness all the more important. Behavioral symptoms can include eating more rapidly than usual, eating until uncomfortably full, and eating large amounts of food when not feeling physically hungry. These behaviors often occur in secret, adding to the emotional burden of the disorder. Emotional symptoms encompass feelings of guilt, shame, disgust, or distress after binge eating. These negative emotions can lead to a vicious cycle where the individual binges to cope with their feelings only to feel worse afterward. Physically, individuals with BED may experience weight fluctuations, digestive issues, and fatigue. These physical symptoms can further impact their overall health and well-being, making it essential to address the disorder holistically. It is important to note that these symptoms can vary in severity and presentation from person to person. Some may experience mild symptoms while others may have more severe manifestations. Understanding this variability is key to providing personalized and effective treatment. Binge eating disorder can have a significant impact on both physical and mental health. In the short term, binge eating can lead to feelings of guilt, shame, and low self-esteem. It can also cause digestive problems such as bloating, constipation, and diarrhea. Over time, repeated episodes of binge eating can contribute to weight gain and obesity, increasing the risk of developing serious health conditions. These conditions include type 2 diabetes, heart disease, high blood pressure, high cholesterol, and certain types of cancer. Binge eating disorder can also take a toll on mental health, leading to depression, anxiety, and social isolation. Sarah, a young woman in her early 20s, had been struggling with binge eating disorder for years. She would often find herself consuming large quantities of food, particularly junk food, in secret, feeling powerless to stop. Sarah's binge eating episodes were often triggered by stress, anxiety, or low mood. Afterward, she would be overwhelmed with feelings of guilt, shame, and disgust. Sarah's binge eating began to affect her physical health, leading to weight gain and digestive issues. She also became increasingly withdrawn socially, isolating herself from friends and loved ones. Section 7. Treatment options, finding hope and healing. Fortunately, effective treatments are available for binge eating disorder, offering a path to recovery. Treatment typically involves a combination of psychotherapy, nutritional counseling, and medication management. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that has been proven effective in treating BED. CBT helps individuals identify and challenge negative thoughts and behaviors related to food and eating. It also teaches coping skills for managing triggers and preventing future binge episodes, fostering long-term well-being. Section 8. Seeking help, resources and support for binge eating disorder. If you or someone you know is struggling with binge eating disorder, it is crucial to seek professional help. There are numerous resources available to provide support and guidance on the road to recovery. The National Eating Disorders Association, or NEDA, offers a helpline, online resources, and a directory of treatment providers. The Binge Eating Disorder Association, or BEDA, provides information, support groups, and advocacy for individuals with BED. Additionally, primary care physicians and mental health professionals can provide referrals to specialized treatment centers and support groups. Section 9. Conclusion, a message of hope and encouragement. Binge eating disorder is a complex and challenging condition, but recovery is possible. By understanding the symptoms, causes, and available treatments, individuals can take the first step towards seeking help and reclaiming their lives. Remember, you are not alone in this journey. With the right support, guidance, and determination, recovery from binge eating disorder is achievable. Embrace the possibility of a healthier, happier future, free from the grips of BED. Section 10. About PsyEduInsights. PsyEduInsights is dedicated to providing accessible and evidence-based information on mental health topics to empower individuals, families, and communities. We believe that knowledge is power, and that by increasing understanding and reducing stigma, we can create a more compassionate and supportive world for those struggling with mental health challenges. Our team of mental health professionals is committed to providing accurate, up-to-date, and engaging content to promote mental well-being. We strive to make mental health information accessible to all, regardless of background or education level.